So welcome back to the channel, hope you're all doing well, and today I'm joined once again by the lovely Sarah Carter all the way from Devonshire. It's like a different planet down there. I'm obviously up north here in central Scotland, and today we're going to talk a little bit about health anxiety. I think this is something that's very topical at the moment with the traumas of COVID in the last couple of years. I think this is definitely something that's worth looking at. So Sarah, I'm just curious, what actually is health anxiety? I think that's probably a good place to start here.
Yeah, I would define health anxiety as being any intrusive thoughts or actions and behaviours around some concern to do with your health. So it could be from obsessively looking at spots and marks, and it sort of triggers this kind of having to check daily, or just noticing that your thoughts are coming back to how you're feeling. What if I'm unwell? Noticing more about how people are not well around you, and basically that focus of disease, contamination, ill health, anything to the point that it's interrupting your day-to-day life.
And I think it's important to say that there is a difference between being concerned for your health and actually having health anxiety, isn't there? I mean, I guess having a concern for your health is quite a healthy thing. You want to have health as your priority. But I think when it then becomes almost like a kind of obsession where the slightest, smallest thing all of a sudden is going to lead to some horrible, life-debilitating or serious disease. So I think that distinction is important, isn't it?
Yeah, absolutely. Yeah, and I think, like you say, as a result of COVID, I think, lots of us are looking at our physical health a little bit more. And with the rise of mental health awareness, we're considering our mental health a lot more, which, like you say, is a good thing. But it's just the tipping of the balance, just when you find that the majority of your thoughts or thinking, actions or behaviours are based around, if you're well, which is kicking off that fight and flight response of, am I safe, essentially. So yeah, anything that's just interrupting your life, how you'd want to be living it, or used to be living it, I would say slips into health anxiety.
Very interesting. So what do you think causes health anxiety? I think there's multiple factors, of course, it's not just maybe one thing, but what are some of the main reasons why someone would start to become overly obsessed about their health?
I think the first one definitely is when you have your own experience of ill health. It could be a health scare, it could be something happening to you which really affects your life, and not just like an illness, it could be an injury as well. So anything that's personally happened to a person that brings to focus this, I'm not invincible, I have a time limit on this planet, and I mean the scale of that and the range of that can be quite extensive, but yeah, a personal experience of ill health or disease or injury that brings to the focus that life could be very different. And then back with that is obviously experiencing somebody that you love, someone very close to you who has ill health. To me, those would be the biggest triggers, because it changes reality, basically, doesn't it?
Yeah, I mean, to be honest, I had my own experience fairly recently. It was during the first COVID lockdown. We had a discussion about this, quite a few times, but I started to have some really, really weird sort of stomach issues. So it was kind of like I was getting like weird spasms in my stomach. I couldn't eat properly. I lost a lot of weight. I was getting very, very strange nerve issues as well, like tingles throughout my body, multiple different, symptoms. And when I went to the doctor, they had absolutely no clue what was going on for me. Even, I paid like a specialist like 200 quid to do a Zoom call, and he told me exactly the same things as the GP did. And for me, it was a very, very bordering on traumatic experience, because it was this horrible thing that was going on for me on a day-to-day basis. No one knew what was going on, and eventually I did get it sorted. I did get to the bottom of it, but it was really, really difficult. And for me, one of the things I experienced which really took me by surprise, as a coach, as a therapist, this is something I'm very aware of, but I've never experienced it before, is because of that near traumatic experience, for quite a few weeks and months after it, I was overly concerned about my health. It was the smallest little thing. I was overreacting. And I think one of the key things I noticed was, and I think this is quite prevalent with people with health anxiety, is I was misinterpreting body sensations. So I would have like a sore throat, and all of a sudden that means it's cancer. It's like, oh my God, it's something horrendous, Or if I had like, a funny kind of lump in my arm, then again, it's something absolutely horrible. And I think that's something that a lot of people who experience health anxiety have, is, because they've had some sort of near traumatic experience in the past, the brain has to learn, it thinks it's under threat, and it's unnecessarily firing off those fight or flight responses, and it causes us to misinterpret signals. So yeah, for me, I think that was a big eye-opener for me, because I've never experienced anything like that before, but I really do have a lot of sympathy for people who are in that position.
Mm-hmm. And there's a real hook in thought that goes on with those things as well. I work with people in end-of-life care and palliative care and in a healthcare setting. And one of the main things that I see linked with the health anxiety in private clients is it's this what-if syndrome, because what happens is the reason you can get so preoccupied about every single sensation is because there's this sort of belief being created that what if this is the time that it's something serious and I just relax and say, hey, just chill out about it, this is nothing to worry about, because that tends to be the response, isn't it? Like, calm down, you don't need to worry about everything, you're trying to regulate your emotions and rationale everything, but something in the back of your head goes, but what if this is the one thing I'm supposed to be getting checked out? And that's what can start this kind of obsession, I think. That because you don't want to get it wrong, do you?
Yeah, absolutely. And I think it's the not knowing too. I think that's one of the things I noticed, is that because I didn't have an answer, I think the human mind wants closure. It wants to close loops. That's why, Netflix have made a career on it. That's why they always end an episode with a cliffhanger. We want to figure out, what happens. So I think when we don't have the answers that we want, if the doctors don't know what's wrong with us and we can't figure it out, then we look to close the gap. We look to close that loop. And often the things that we put in order to close the loop aren't particularly healthy scenarios. One of the big mistakes I made was I consulted the Google doctor. And let's be honest, the Google doctor is a total bastard. Everything leads to death. You have a pain in your arm, you're going to get your arm amputated and you're going to die. You've got a headache, that means you're going to have an aneurysm, then you're going to die. Google doctor really is a bit of a bastard. And one of the mistakes I made was I bought into the scenarios that Google was presenting. It was actually nothing to do with what was going on. It was actually a physical injury I'd got through exercise, or certainly that's what we believe. So I think it's that filling in the gap, isn't it? If we don't get closure on things, if we don't know the answers, then our brain just seems to fill it with scenario after scenario, and those scenarios aren't often the most positive.
No, and we fill it with the nearest story we've got going, and it's never the good story. It's the bad one, and that's what our tabloids and social media is filled with. This person who had no signs of this rumbling bladder cancer other than this tiny little symptom, and of course that in and of itself is devastating, and it does happen, and I'm not trivializing that whatsoever. But in terms of what you're saying as a process of filling in the gap, those are the stories we then remember and relate to with the gap in knowledge with our own experience, and of course it naturally leads to a huge anxiety, understandably so, I think.
Very interesting. So what do you think in terms of if there's anyone watching this that is experiencing health anxiety, that is overly obsessed with these small things that they're experiencing, and of course, as we said, it's very healthy to have a concern for your health, but it's where it spills over into something a bit more intense and a bit more serious, then what kind of solutions do we have that can actually help them move forward?
Yeah, I think the first one would be to identify whether you're a secret health anxiety person or whether you're open about it. So actually, I think more often than not, because people are somewhat aware that perhaps how they're behaving and thinking is somewhat irrational, they get very embarrassed about actually even talking about it. And so I think there's a lot of this going on in secret for people. The other end of the extreme are those people that we probably know who every day there's something wrong, and then there's a nice clear label for that, which is the hypochondriac, which in and of itself can have its own problems. But for the sake of this talk today, probably identifying with those people who maybe not be talking about it. And I think that's the first thing to do, because it's such a build-up of tension, which is going to make all of your symptoms, whatever they may be, worse. So it's about stopping the spiral down and interrupting that, so you can bring yourself back up. And I think to be able to talk about it and to be able to acknowledge it for what it is without judging yourself is a good place to start. Yeah.
It's very interesting, because when I think of like hypochondria and health anxiety, I do always naturally think of the person who is, you know, constantly telling you everything that's wrong with them every single day. But I'd never actually thought about the more sort of introverted form of health anxiety, where people are a little bit a bit embarrassed to talk about it, so they end up going inwards, and they're fighting this horrible internal battle, and no one really knows about it, and they're having to deal with it just on their own. So I think that's great advice. You know, talk to someone, get it out in the open, and when you talk about it, it can always make things better. I think for me, like, I think it can sometimes be really, really useful to go to therapy as well. I think one of the good things about therapy these days is it's becoming very sort of hip and trendy. It used to be the thing you did when you were so messed up that you couldn't do anything, that you were just basically a total mess, a total basket case. But now, you know, it's actually quite trendy to have a therapist or have a coach. And I think that's an amazing thing. So, as we mentioned earlier on, often health anxiety can be triggered by some sort of traumatic experience that you've had to do with your health. So maybe you've had a genuine health scare and you've managed to overcome it, or maybe it's maybe not been, you know, massively huge, but it's still been very, very bad for you. And often there can be some sort of spillover, and this can then cause us to be overly concerned, overly obsessed with these small indicators that could potentially mean some sort of health issue. So I think if that's a scenario for you, I think it's really useful to speak to someone, go see a therapist, and they can help you go back and sort of let go of that traumatic experience so that it no longer has the same impact on you. I think often that's a really good place to start as well. So I don't know, do you have any other advice that you want to share, Sarah, before we just bring this video to a close?
I think just very, very briefly, it's what can also be a good thing is to actually ask how you are feeling. And this might be more for people who have had a diagnosis. So if something has happened that has changed the direction of your life slightly, it's totally understandable to then be in a really, you know, sensitive place. And often what I will say is, don't try as much as you can not to base the barometer of how you're feeling based on your diagnosis and that label, but to actually ask how I'm feeling. So an example of that, just to make it a bit clearer, is I work a lot with cancer patients, and naturally some of those conversations can start about the cancer and everything that they're worried about and what's coming next and all those things. And the level of anxiety can be so high, but when we actually pick it apart and I just ask that simple question, how are you today? Like, how are you actually feeling? Let's try and put all of that to one side just for the moment. How is your body actually feeling? What are your symptoms today? What is your level of comfort? And they really connect and kind of go, I'm okay. Sometimes that is such a better marker for how you're doing than your diagnosis. So that might just be quite useful for people to hear out there if you know they have heard some upsetting news or something like that.
I love that. It's almost like a kind of mindfulness exercise, isn't it? Because when we are labelled as having some sort of health issue, then it can be so easy to attach, you know, lots of meaning to that label. And I think often when we are worried, when we're feeling anxious, it's usually because we're trapped in the world of thoughts. We're either, you know, worried about things that have happened in the past, or we're playing movies of things that could potentially go wrong in the future. We're catastrophizing. Whereas I think if you do bring yourself back to the here and now and be so much more mindful, then all of that just temporarily disappears, and you can just pay attention to what's going on with you right in this moment. Some additional things that I'd just like to add in, things like breathing. You know, I know we all breathe all the time, but there are different ways to breathe. if you really just take a few moments to center yourself, breathe from your diaphragm, from your belly, and really connect with the present moment, with the here and now. Also just being aware of things that you do, activities that allow you to become more connected with your experience. Those will allow you to just go into the moment, so you're not getting trapped in, horrible scenarios about what the future could entail and terrible things that could potentially happen. Any sort of mindfulness process like that can be really, really powerful, just to bring yourself into the moment, and just to bring yourself more into your centre. And I think that can make a huge difference to how you're feeling in the moment. So I think...
Oh, sorry. There is just one thing, if I may. What you're exposing yourself to. So it's sort of what you're describing. So engaging with what feels good, but being aware of what doesn't feel so good and just disconnecting from it. So definitely getting off of the Google Doctor, and just mindful of like what you're watching, what you're listening to, and you don't want to be feeding the problem in any way.
Yeah, if there's one piece of advice you can get from this video is the Google Doctor is a bastard, if you excuse my language. But really, I mean, you don't want to listen to him or her. But so that is us for this video. Hopefully you enjoyed this on health anxiety. If you experience health anxiety, then please do let us know about it in the comments. If you have any questions, if you have anything you'd like to see on the subject, then we'd love to hear what you think. So that's all for us for today. Have a great week, and we'll see you later on.